Once the appropriate size has been fit, have the patient sit at the edge of a firm chair with his hips flexed to 90 degrees. The patient should be experiencing mild pressure on the flexor tendons of the hip joint. The fitter can check this by placing their index finger between the flexor tendon and the inferior border of the brace and have the patient flex forward to achieve 90 degrees of hip flexion. There should be pressure on the index finger from the brace and patient's leg. This pressure reminds the patient not to flex his hips beyond 90 degrees. While the patient is in the seated position, the anterior superior border of his TLSO is to be checked for adequate clearance of the sternal notch and clavicles. The orthosis should not impinge upon or be more than 2 inches inferior to the clavicles or sternal notch. There should be ample room for the patient to look down into their lap. Have the patient sit back into the chair as if driving a car. Have the patient simulate the motions of driving a vehicle, such as pushing the gas, brake, and clutch pedals, as well as gripping and turning the steering wheel and shifting gears. The patient should have adequate range of motion at the shoulder and hip joints to achieve this. The posterior superior border of the orthosis should cross in the area of the spines of the scapulae. The patient should not have excessive motion of the shoulder girdles, nor should they be able to achieve significant transverse plane motion of the thorax. While seated, the posterior inferior border of the orthosis should be within 1.5 inches of the seat and 1 inch of the level of the coccyx. All patients should be referred to physical therapy for training on activities of daily living while wearing their orthosis. These activities include, but are not limited to, donning and doffing the TLSO in erect and supine positions, ingress and egress of vehicles, proper seating and toilet heights, and performance of personal hygiene. I have examined the TLSO on Mr. Ross and have determined that the orthosis matches the prescription as written and meets the requirement for the patient's condition. This TLSO functions to increase abdominal compression, limit motion of the thoracic and lumbar spine, reduce the patient's pain, and protect the injury site. Mr. Ross has demonstrated the ability to perform ADLs, and I have given him instructions to assist in these activities. Mr. Ross has demonstrated the ability to doff and don the orthosis, and appropriate instructions were given to facilitate this. This orthosis meets Dr. Brown's requirements of fit and function. Mr. Ross has been instructed to call the office with any questions not covered in the patient handbook or should any difficulties arise. He has been given a follow-up appointment in 2 weeks.